All right, today we're going to dive into one of the biggest public health battles happening anywhere in the world. We're talking about India's massive, decades-long war against two incredibly tough diseases, HIV and tuberculosis. Just think about the scale for a second. You've got two relentless epidemics, a population of well over 1 billion people, and a national strategy that's aiming for nothing short of total elimination. It's huge. So that brings up the big question, right? How on earth do you even begin to design and pull off a public health plan that's this massive? Well, let's get into it. To really understand the strategy, we first have to get our heads around the sheer size of the problem. India is up against two different, but very dangerously connected epidemics. So let's kick things off with HIV. In India, there are an estimated 2.14 million people living with the virus. Now, to put that number into perspective, that's a population bigger than the entire city of Houston. And every single one of those people needs long-term care, treatment, and support. And then you've got tuberculosis, or TB. If we look at the data from 2015, the numbers were just staggering. An incidence rate of 211 new cases for every 100,000 people. You know, TB is an ancient disease, but it is still a very real, very deadly threat across the country. Faced with these kinds of numbers, India didn't just react. It built a really detailed national blueprint to fight back. So let's break down how this whole strategy came together. And look, this wasn't some overnight plan. It's been a long, evolving fight that really kicked off back in 1986. By 1992, the National AIDS Control Organization, or NACO, was created, and it launched the first of many national AIDS control programs. The whole strategy has been tweaked and improved over decades, leading us to the current version, Phase 5, which is set to run until 2026. And the goals for these programs, they're incredibly ambitious. I mean, for tuberculosis, the goal is total elimination by 2025. And for HIV/AIDS, the vision is even bigger, a future with zero new infections, zero AIDS-related deaths, and, this is so important, zero discrimination. Now, this chart might look a little complicated, but it shows you the core idea behind the entire strategy. Right there in the middle, you see it, beneficiary and community in center. This is a huge deal. It shows a real shift away from just a top-down government program to something that's really a people-first movement, built on community involvement. So you have this grand strategy on paper, but how does that actually translate from a policy document into real action on the ground for real people? Let's take a look at the specific things they're doing that are making a difference. This organizational chart gives you a sense of the sheer machinery behind this mission. NACO is coordinating everything from lab services and blood safety all the way to treatment plans and data crunching. It's like a complex central nervous system designed to get a ton of different services to every single corner of the country. Okay, let's zoom in on one specific program that saves so many lives, preventing HIV from passing from a mother to her child. First, every pregnant woman gets routine testing and counseling. Then, the approach is family-centric, so they bring spouses and family into the loop. For mothers who are living with HIV, they get lifelong antiretroviral therapy, or ART. And finally, they make sure these mothers can give birth in a safe medical facility. It's basically a holistic shield for the next generation. What's really smart about this whole strategy is that they know a one-size-fits-all approach just won't cut it. Instead, they focus their resources with these targeted interventions for key groups that are at a higher risk. We're talking about sex workers, men who have sex with men, injecting drug users, and also groups that are on the move a lot, like migrants and truckers. Now, this is absolutely crucial to understand. These two fights are not separate. HIV weakens your immune system, which makes a person incredibly vulnerable to TB. And that's exactly why the strategy is integrated. They tackle both diseases at the same time through coordinated prevention, early detection, and combined treatments to save more lives. Okay, so we've seen the plan, we've seen the strategy. The million-dollar question is it actually working? Let's turn to the data and check out the scorecard. The targets for getting rid of TB are, well, they're breathtaking. The plan is to slash the incidence rate from 217 per 100,000 people all the way down to just 44, and to cut the mortality rate by over 90%. But look at that last goal, to completely eliminate the catastrophic financial costs that TB puts on families, taking that burden from 35% of households down to 0. That's life-changing. For HIV, the global finish line is something called 95-95-95. It sounds a bit like code, but it's pretty simple. It means 95% of people with HIV know they have it, 95% of them are on treatment, and 95% of those people have their viral load suppressed, which means the virus is so low it can't be transmitted. So where's India on this journey? Well, the data shows 90% of people with HIV know their status, 83% of them are on therapy, and 85% of them are virally suppressed. So there's been clear progress, but there's still a road ahead. And this chart here, it really tells the same story. Amazing progress, but there are still some gaps to close. The country achieved a 48% drop in new infections, but the target was 75%. And while getting people on treatment and achieving viral suppression are high at 83 and 85%, they're still a little shy of the 90% targets for this period. The momentum is definitely there, but that final push is going to be critical. All of this data, all these charts, they bring us to the last and maybe the most difficult part of this war, crossing the finish line. That final mile is always the hardest. And as we think about that final mile, this quote from the National TB Plan really brings the whole mission back to its human core. The ultimate win isn't just about statistics on a chart. It's about making sure that no family has to face financial ruin just because someone they love gets sick. Which leaves us with one final huge question. India has built this incredibly sophisticated, always evolving, and deeply ambitious public health machine. The data shows incredible progress, but it also shows the enormous challenge that's still ahead. So can this monumental effort actually win its war against two of our oldest, most persistent enemies? The answer to that is going to define the future of health for millions and millions of people.